Hey there. If you're a parent of a child with progressive myopia, trying to figure out the right eye care options can feel, well, completely overwhelming. So let's cut through the noise. Our goal in this explainer isn't to try and sell you on the most impressive or flashiest new technology. Instead, we want to help you find an evidence-informed plan that your child can use safely and consistently, day in and day out.
To do that, we're going to navigate through 4 primary unranked categories. We'll briefly look at the proactive philosophy of myopia management, then review specialized glasses, daily soft contacts, overnight orthokeratology, and low-dose atropine, before finishing up with a framework for choosing the right plan.
Section 1. Understanding myopia management, a proactive approach. Before we dive into the specific options, it's absolutely crucial we understand the foundational philosophy behind modern pediatric eye care. There is a massive, brilliant paradigm shift happening in eye care right now. The traditional approach was all about merely correcting today's blur. Standard glasses clear up vision right now, but they literally do nothing to stop the physical growth of the eye. Myopia management, on the other hand, is a proactive strategy. It specifically targets that future progression to slow down what we call axial elongation, which is just a fancy term for the stretching of the eyeball. That is the absolute key to protecting your child's long-term eye health.
Section 2. Specialized eyeglass lenses, Essilor Stellest. Let's look at our first clinical option, utilizing a format most families already know and love.
We're talking specialized myopia management eyeglass lenses, like Essilor Stellest. These seamlessly correct distance vision while simultaneously using a specific, highly engineered lenslet design to actually manage the myopia. This is a hugely appealing option for families who just prefer glasses overall, or maybe have a younger child who simply isn't ready for the responsibility of handling contact lenses quite yet.
But we always have to look at the clinical realities. Keep in mind that while FDA-authorized clinical trials show fantastic group results for these lenses, group statistics do not guarantee outcomes for an individual child. Plus, to be appropriate and effective, these lenses must be used strictly within their FDA-authorized initiation ages and prescription parameters.
Section 3. Daily soft contact lenses, MiSight One Day. Our second category moves us away from glasses entirely and introduces a daytime contact lens made specifically for eligible kids.
MiSight one-day lenses are honestly all about convenience. These are daily disposable soft contact lenses designed to simultaneously correct vision and slow myopia progression. Because your child pops in a fresh, sterile lens every single morning and just throws it away at night, there is zero overnight wear required, and absolutely no complex daily cleaning routine for you to supervise.
However, because this is a medical device sitting right on the eye, there are strict rules. Impeccable hand hygiene, non-negotiable. Safe insertion and removal, totally avoiding water exposure while wearing the lenses, and adhering strictly to FDA-approved initiation ages and prescriptions are required for your child's safety. Consistent follow-ups with your eye doctor are a must here.
Section 4. Overnight orthokeratology, or CRT. This third option flips the traditional contact lens schedule completely upside down.
Now here's the massive lifestyle perk. Corneal refractive therapy, commonly known as Ortho-K, uses special rigid lenses that your child only wears while they sleep. The lens gently and temporarily reshapes the front of the eye, the cornea, overnight. When they wake up, boom, they can function clearly throughout their entire day without any glasses or daytime contacts. Just keep in mind, the reshaping effect is temporary, so regular overnight wear is definitely required to maintain that clear daytime vision.
Clinically speaking, you should know that U.S. Ortho-K products are FDA cleared for temporary vision correction. The myopia control discussion actually relies on broad category-wide evidence for orthokeratology, rather than a product-specific FDA myopia control indication. And because these are worn overnight, corneal topography mapping, spotless hygiene, and dedicated parental supervision are absolutely essential.
Section 5. Low-dose atropine drops. Our fourth and final primary option steps entirely away from optical devices.
This involves a pharmacological approach. Low-dose atropine is a daily prescription eye drop considered for certain children. What's absolutely fascinating here is that the exact concentration of the drop matters immensely for its effectiveness. While it's generally really well tolerated, some kids might experience mild light sensitivity or slight near-vision blur. It's also super flexible. It can be used all on its own or sometimes alongside other optical treatments.
A major clinical note here. Using atropine for myopia is currently an off-label use in the United States.
Also, clinical data, including sources straight from the National Eye Institute, indicates that the very low 0.01% concentration is actually not proven effective in U.S. children for slowing progression. Because of that, higher low-dose concentrations are often required to see a real clinical benefit.
Section 6. Choosing the right plan. Let's wrap this up and see how all of this builds into a practical decision-making framework for your family.
When we stack these options side by side, you can really break down the crucial dimensions of each treatment and visualize how they fit your child's daily life. Do they prefer glasses, like with Stellest? Are they mature enough for daily insertion and hygiene with MiSight? Does the glasses-free daytime freedom of Ortho-K appeal to your athlete, assuming they have the red corneal shape? Or is the quick daily drop application of atropine the best fit? Take a moment to see how these handling requirements match up with your actual real-world routine.
Your eye doctor isn't just going to guess here. Their recommendation will be guided by this entire multifaceted list. They look at clinical factors like age, prescription, progression rate, and corneal shape, completely blended with lifestyle factors like sports, hygiene capabilities, and parental supervision. Also, keep in mind that sometimes these treatments can actually be combined for optimal results, though combo therapy isn't automatic and depends highly on the individual child.
Okay, I need to emphasize the most important takeaway of this entire explainer to set really healthy, scientifically accurate expectations. While we have incredible tools to proactively manage and slow this down, absolutely no option cures myopia, reverses established eye growth, or guarantees the progression will 100% stop. It is all about risk reduction and protecting their vision for the future.
This educational explainer was prepared from clinical resources carefully reviewed by Dr. Rawzi Baik at Eyecare in Cincinnati. We highly encourage parents, especially those in the Cincinnati area, to use our linked treatment articles as a preparation toolkit. It will seriously help you ask the right questions before you walk in for a dedicated myopia consultation.
Remember, this explainer provides educational information only. Every single eye is totally unique, and an individual examination is absolutely required to determine the safest, most effective plan for your child. So as you look at your family's chaotic morning rush or your busy evening routine, which of these paths actually feels like a realistic daily habit for your child to stick with for the long haul?